Please feel free to have your cameras on or off this evening. It's always very nice to see a few faces, but whatever you feel comfortable with. Okay, we'll begin and then people can join us as they start. So thank you so much for joining us this evening. Myself and Barry, who I'm going to introduce in a moment, are going to be talking about how you can prepare your body for planned surgery. And we're going to be talking a bit about what to expect. We're going to be giving you practical things that you could take away and put in place straight away if you wanted to. So I hope you leave feeling like you know more and like you've got things you could do straight away. So my name is Rebecca. I'm a registered dietitian and practice manager at Coombe Grove. So I look after our programs here. When I say here, we are a centre for metabolic health set just outside of Bath. And I'm joined this evening by Barry Edwards.
Hi, everybody. I'm Barry. I'm a clinical specialist physiotherapist. I spent quite a lot of time working in elite sport, and now I work in a local private hospital, part of the Circle Health Group. And I've been working here at Coombe Grove for 35 years as both a fitness instructor and teaching exercise classes. And now I'm just getting a little bit more involved in what's going on with the metabolic health retreats and rehabilitation programs, etc.
Thank you, Barry. So Barry's been here 32 years longer. 32 years longer than I have. So yeah, he's bringing all of his insights and experience to share with you this evening, because there's an awful lot that we can do to make a difference with planned surgery. So this is what we're going to be talking about this evening. So how metabolic balance can help with planned surgery. So we're a centre for metabolic health. So I'm going to talk a little bit about what that means and how by resetting your metabolic health, it can make a real difference to how you feel about your upcoming surgery, get you in the best place for it and help you recover quicker and have that mobility quicker. Barry's going to talk about what to expect when you're in hospital after your surgery and when you go home afterwards, and give you some thoughts about how you can get your body strong, both at home or if you use a gym. Also going to talk a little bit about some of the exercises that you could use after surgery, so you can feel confident knowing what you can put in place straight away. And a lot of this evening is about helping you feel empowered, like you can take charge of what is coming up, because some of it will feel like it's out of your hands, you know, the surgery itself. So what can you do to get yourself as fit as well as possible, for everything to go smoothly and get the result that you want? I'm then going to talk a little bit about the 5 routes that we use here at Coombe Grove to improve metabolic health. I'm going to talk about nutrition and how that can help you with specific health markers that you may want to focus on. And I'm also going to give some tips around sleep, environment and mindset as well. And then finish up with our top tips. I will talk a little bit about the programs here at Coombe Grove. So if anyone wants to delve into that more, get that personalised support, they can. And we're going to have time at the end for your Q&As. So if you've got any questions at any point, please pop them into the chat box and we'll make sure we've got time to answer as many questions as we can. Just want to mention that nothing we're talking about this evening is individualized advice. We're going to be talking about general things that you might want to consider and see if anything is helpful to you. And always, if you're making changes, talk to your healthcare professional. So let's begin with metabolic health so we can see why this is important. Well, metabolic health is basically describing your engine. It's what's helping you and your body to run every day, what's keeping you well. And if your metabolic health is good, then you are able to go about your day with ease. Your body's able to keep you healthy. So it describes our ability to be able to store, digest, process, and use fuel whilst keeping us feeling good and thriving. So everything that happens from the moment you eat food to that food being then broken down and either stored to use for later or used for fuel, this is our metabolic health. And if your body can do that fairly easily and maintain balance throughout, then your metabolic health is good. If, however, it takes longer for your body to bring back balance, if it's more difficult, then your body isn't able to focus on all those everyday things. It's not able to focus on repair and optimizing your health. It's busy working on that, bringing back balance. So metabolic health is measured. There's a number of measures that are often measured routinely. So things like, for example, body weight, blood pressure, lipids, waist circumference. These are all commonly measured. Here at Coombe we use 10 markers of metabolic health because we really want to look holistically. And when all those measures of metabolic health are in the normal range, then you have good metabolic health. And this is what it's all about, really. It's about your body maintaining homeostasis. This is what it's trying to do all the time. Bring things back to balance. And then your body's in a place of ease or calm rather than working hard and being in a place of war. Now, if you have imbalanced metabolic health, then this is what it might show up like. So pop in the chat box if any of you recognize any of these signs, if they are familiar to you. So feeling tired, feeling sluggish, not having the energy you want to get through the day, imbalanced mood, perhaps symptoms of anxiety or low mood, depression, feeling hungry or having cravings often. So maybe having dinner and still feeling like something else, or feeling hungry every few hours. Having aches and pains. You know, we all have aches or pains or injuries, but it's when these aren't going away. And for you this evening, I imagine this, particularly resonates. Our metabolic health is linked to the pain that we're experiencing through inflammation, just one of the mechanisms. So it might be as well as if you're preparing for a surgery, you've obviously got that pain, but it might be general aches and pains as well you're experiencing. Things like blood glucose levels rising blood pressure, other markers of metabolic health. For women, menopause symptoms might be lingering longer than you'd want them to, or causing distress. Weight gain, and particularly around our abdomen and that visceral fat, which really impacts how our organs are functioning, and just a general not feeling as good as you'd like to and deteriorating health. So does anyone recognize any of these signs and symptoms? Is that anything that you're experiencing at all? As well as those daily signs and symptoms, metabolic health also contributes to most of the chronic conditions that people experience. So you can see on this tree of metabolic health, all of these conditions metabolic health contributes to. So things like prediabetes, cardiovascular disease, brain health, dementia, PCOS, everything from the bottom of our body right up to the top. So thinking about metabolic health and getting that balance before surgery can make a really big impact on your experience and recovery. And these are some of the reasons why. If your metabolic health is balanced, if you are reducing things like your blood glucose levels, blood pressure, visceral fat and weight generally, that's going to make an impact going into your surgery. We know for a lot of surgeries, and thinking particularly this evening about knee and hip replacement surgery, the biggest risk factors for those surgeries are those markers I've just talked about. So uncontrolled blood glucose levels, having diabetes, hypertension, weight. So bringing those down can make a big difference. And metabolic health is a tool that allows you to do that. Minimizing the risk of complications. So there's various evidence now showing that focusing on metabolic health and focusing on a comprehensive prehab program can make a really big difference. being able to mobilize early. So focusing on the most effective movements are going to build those core muscles, build the strength and flexibility so that after your surgery, those muscles can support you. And Barry's going to delve into that in a moment. Improve function. So getting you the function that you're wanting, that you're expecting after your surgery. Increase confidence and empowerment. This is really important, that you feel prepared, that you feel ready, that you have the tools, the strategies, the knowledge, ready for what's ahead of you and ready for afterwards. Helping reduce the length of your hospital stay, getting you home, back into your comfortable place as quickly as possible with everything that you need. And reduce pain. So this study at the bottom, but various of other studies as well, have shown that, again, a prehab program can make a difference, not only in reducing complications, length of hospital stay, function, but also reducing the pain that you feel too. So those very practical things in terms of being able to climb stairs earlier, being able to get out of bed, but also your experience and pain too. So at Coombe Grove, we use the 5 routes of metabolic health in order to help people to optimize how they're feeling. And by working on these 5 routes, you can make a phenomenal difference. And we see people putting their pre-diabetes into remission within a month. We see people bringing their blood pressure down when they're staying with us within a week. So they can make really rapid changes, and everyone can make a change no matter where they are. Just depends how quickly and how dramatically that is. So we use nutrition as our core route, and movement, and particularly with prehab, is so important and vital. But all of these routes and together, when we use them all collaboratively, have the biggest impact on people changing their metabolic health and making a difference to those markers I've spoken about. Okay, so we're going to begin with that movement route, and I'm going to pass you over to Barry to talk you through this route, what you can do and what to expect. I'll hand over to you, Barry.
So, hi everybody. Probably the 2 most common joint surgeries that I see and I'm involved with are hip replacement and knee replacements. So a lot of people now are coming in younger and having hip replacements or knee replacements, mainly because they sort of understand that the quality of life is quite important to them. So rather than waiting an extra 20 years down the line and then being in a real bad way by the time they have it replaced, they've decided, actually, why don't I enjoy life a bit earlier? I mean, the lifespan of, say, a hip replacement is, on average, they say around about 15 years, maybe 20 years. Knee replacement, they give around about 20 years. A unicompartmental knee replacement, quite often it's touted as around about 10 years or so. There are exceptions to the rules. I know of people who had hip replacements maybe 20 or 30 years ago, and they've still got the same hip replacements in now, and they've been playing tennis and skiing all this time with no real problems. The hip replacements nowadays are much, much better. We've recently had people getting back to hockey on AstroTurf in about 4 months, a younger person around about late 40s, early 50s. And so, the surgeons nowadays are saying, yes, you can do some impact. They advise that your best type of exercises are low impact, such as cycling, swimming, short runs rather than half marathons and ultra marathons, etc. But again, some people do this with the hip replacements. And what we're also finding is that the fitter and stronger people are when they come in for the operation, the better the results are after. So it's in everyone's best interest really to get yourself fit and get the muscles strong, so that you'll still get pain after the operation, but the muscles will recover quicker. And in conjunction with the sort of like the metabolic health and the 5 routes of metabolic health, it can really, really sort of like enhance your recovery afterwards. So what we do is when you come in, we'll give a pre-admission assessment. So we'll look and see what your quality of life is now, then how far you're walking, what sort of exercises you're doing. And then we'll send you away with some exercises to do prior to the operation, just to help get you in a little bit better shape. On the day of the, when you come in for the operation, what we try to do these days is, if you've gone to theatre early enough, we will get you up the day of your surgery. So on what we call day 0. In some places, including our place, we have actually got some people home on day 0. They've been operated on early in the morning, early evening, they go home. So, and that's possible, 1, if they're fitter, and 2, if they've got a really good support network at home to cope with them. If they don't go home day 0, most people nowadays, they go home day 1. So it's rare that people are in 2, 3, and 4 days. The importance of early mobility, from a research point of view, has shown that the quicker we can get you up, get you moving, and get you home, the better it is. Is it painful? Yes. There's no two ways about it. An operation is always going to be painful. We do get some exceptions where the next day they're so good you wouldn't think they've had a hip replacement or a knee replacement. But generally, you are going to get some pain. Knees especially can be very, very sore, especially day 2, 3, maybe 4 and 5, when the swelling comes through, the bruising comes through, and you find it's very, very difficult to actually move your leg at all. So we always give some sort of like alternative exercises or ways that you can do that when you find that no matter how you try, you cannot sort of like straighten your leg or do what we call a straight leg raise, lift your leg off the bed. We will supply TheraBand so that it enables you to do that, so you can keep doing the exercises. And before coming in, if you're a member of a gym, brilliant. It means that you can actually get there and you can do lots of exercises. If your hip or knee is very sore and you find it's difficult to actually move and get in the gym, then getting in the pool, either swimming or just doing some really gentle exercise, walking side to side across the pool in the shallow end, forwards, backwards, would be a really, really good thing to do. When people haven't got a membership of a gym, we will quite often send them exercises via a software package that we've got called PhysiTrack, which has got thousands of exercises on. And we choose a variety of exercises that we can then send across to you. They have video demonstrations of each exercise so that you can see what you're supposed to be doing before you actually do it. And then you arrive in hospital and you're in the best possible place to get that recovery. And then we follow you up after by, again, keeping in touch with the exercises and giving you extra ones that you can do post-operation. First 2 weeks after the operation, it's always going to be lots of rest. Do some basic exercises, little and often, but more importantly, get rest. You find it's a big operation and it really, really takes it out of you. When you first get out of bed and you walk up the corridor, walking just 10 to 15 meters sometimes can seem like it's a marathon rather than just a short walk. And so it really is important to get that rest and get that good night's sleep. And that's where the nutrition, the mindset and everything else comes into it as part of the metabolic routes. And outside of a gym, if you think, well, I haven't got members of a gym, I haven't got an exercise bike, I haven't got access to a pool, then there's a lot that you can do at home. A dining room chair, you can do sit to stands, which is an alternative to doing squats. And again, that's just going to keep your quads, your hips, and everything moving. And you can vary the speed of the reps so that you can still manage to increase your strength to a certain extent before you actually come in. Upper body strength is another good thing. Sometimes when people are coming in for hips and knees, exercises have concentrated on what's going on from the waist down. But you usually find the hardest thing after a hip or knee operation is getting out of bed. The stairs are easy. But getting out of bed sometimes is the hard thing. So if you've got some upper body strength, that helps with the bed mobility, moving across and back. Pass you back to you. So I'm going to pass you back to Rebecca.
Thank you.
And we'll catch up again later if you've got any questions.
And upper body strength, are there sort of simple exercises you'd recommend, Barry?
There are, yes. Again, with TheraBand, or even with a dining room chair with arms on, just placing your hands on the chair and lifting yourself up off the chair and lowering yourself down, which builds the shoulders up, the triceps up. Because one of the things is when you're moving around on the bed, if you can actually push on the bed to lift your backside off the bed, it'll help you move up and down the bed a lot easier.
Brilliant. So some tricep dips.
Tricep dips, yeah, and obviously sit to stands from the chair, getting up, sitting down. There's a body of research coming through now, testing with certainly older people in their 60s and above, that there's a certain number of sit to stands without using your hands they expect you to be able to do. If you can do that, you're less likely to have a fall. Break something, basically.
So it's going to help not only surgery but also afterwards as
well. Oh, most definitely. The older we get, and I'm in that old age group now, the stronger we need to be just to sort of maintain ourselves.
And if people are they have got surgery coming up, what would you recommend in terms of number of sit stands and tricep dips they put in place?
If it's at home and you've only got you've got nothing else to use from a resistance point of view, then sometimes just doing a slightly higher volume of say 15 repetitions and doing say 3 sets, maybe with about 45 seconds rest in between each set, would be quite good. Sometimes you can add resistance to that. If you've got a carrier bag or a rucksack, you can put cans of beans in there, hold that across the chest, and that gives a little bit of extra resistance, a bit more progressive overload, strengthen the muscles up a little bit more. Also, getting out and walking is another brilliant thing you can do.
So some simple stuff everyone can
do. Yeah, definitely.
And if you're walking, and if you do walk already, people could sort of build that up, do some hills if they're able to.
Yeah. There was a saying years ago, whenever you can, walk the dog. If you haven't got a dog, walk the dog anyway.
Yeah, it's really interesting. I often have conversations with people and they say they've not got a reason to go out for a walk. And I say, why would you take your dog out for a walk? Because the dog has to go out for a walk, but they're not applying the same thing to themselves. And I have to go for a walk. I think that's, perfect. Walk with a dog or without, walk yourself.
Definitely.
Fantastic. Thank you. So building on what we've been talking about and those strength training exercises, so a really good place to start is both the lower body with sit to stand and walking, and then the upper body with tricep dips. So focusing on getting those in place, find a time of the day that's going to stick, that's going to be easy to sort of make it consistent. If you can add that onto a habit you already do, that's a really good way of making that habit stick and being able to do it day after day for a few weeks to make that difference you want. So for example, every time you get up to make a cup of tea, that could be when you do some sit to stands before you get back on with some work. Or when you sit down for a meal, you could do your tricep dips then.
Exactly. It's always trying to, when people sometimes have said to me, well, I don't have time to exercise, I've got too much to do. Say, well, if you're working from home, for instance, you come down, you're making yourself a cup of coffee, while that kettle's boiling, you could be doing some exercise. You could do some press-ups on the tabletop, some sit-to-stands from your chair. There's always time to find exercise. If you're working telly in the evening, the adverts come on, do some exercise.
And I think often we're told about, doing 30 minutes or doing 45 minutes at a time, but both you and I know, don't we, in practice, that doing these little activity snacks and these little minutes, that's what you can keep doing day after day, and that can really make a difference, can't it?
It can make a fantastic difference, yeah.
So don't be put off, start small, and sometimes having those small habits is what really makes it sustainable. And this comes on to my second tip for movement, which is to plan activity snacks, and particularly after dinner. So if you want, what we want you to do is to have some things that you can put in place that are as powerful as possible for you to see the biggest benefit before surgery. So that's why I'm talking about doing some sort of activity after dinner, because our dinner, our evening meal, is often one of our biggest meals of the day. And as we go through the day, we become more resistant to the effects of insulin. Now, insulin is your hormone that helps take your glucose or your sugar from your blood into your cells. And if it's not working as well by the evening, this means your blood sugar levels are likely to stay higher for longer. So in the evening, insulin doesn't do that as effectively as it does in the morning. So to help it out, if you do some activity, do some movement after your evening meal, your muscles are going to soak up some of that extra glucose from your blood. It's going to help bring your blood glucose levels down. This is really going to help you. If doing this every day is going to help bring your blood glucose levels down, can help reduce your HbA1c, help you get in a better place for surgery. What it's also going to do is help with your sleep. Because if we go into the night with our blood glucose levels higher or our blood glucose levels more unstable, that can impact the quality of your sleep and have less restorative sleep. And sleep is massive in terms of the impact it has on our metabolic health, which, remember, is your underpinning health and well-being. So can you fit in a little bit of activity after your evening meal? So as it's getting lighter, as it's getting nicer, it's more appealing to go outside for a walk. Can you go for a 10 or 15-minute walk after exercise? Bring your blood sugar levels down. That's obviously going to help with blood sugar levels. It's also going to have an impact with overall insulin resistance, inflammation, markers such as your weight. If it's not a nice evening or you can't go out for a walk for whatever reason, then something like, depending obviously where you are and what surgery is coming up, could you find something that works for you? Could you have a kettlebell or a dumbbell and do some resistance training with those, using those muscles? If you're able to do stairs, could you go up and down the stairs? It could be something inside the house. So that's the two core takeaways for movement: strength training and plan activity snacks after dinner. So moving on to nutrition, which is another core route, really important for your metabolic health and really important for you to be in the best place for your surgery. So obviously this is a big topic. This evening I want to give you some core takeaways for each of these routes. So for nutrition, one of the most powerful things you can do is to prioritize protein at each meal. So thinking about getting protein in, whether you eat animal protein, plant protein, a combination of both, thinking about, right, have I got some meat or some fish, some tofu, some tempeh, some eggs, some beans or pulses? Have I got that in there? Now, protein is going to really help you because you're going to be focusing on building your strength and your muscles. You need protein alongside that in order to help you to build muscle. Protein's also fantastic for stability and energy. It'll help to stabilize your blood glucose levels over the whole day. This is going to help give you sustained energy throughout the day. And it's going to help reduce the risk of your blood sugar levels spiking as much, coming back down. When this happens, we start looking for something to bring them back up. And, at the moment, there's processed food everywhere and snacks everywhere. The chances are, if you're not having enough protein, there'll be a point when our blood sugar levels come down. We get tired, we get hungry, and we're more likely to reach for those snacks, which are going to increase inflammation and make it harder for you to be in your best health before surgery. So prioritize protein at each meal, particularly your first meal of the day, whether that's breakfast, whether that's brunch, or whether that's lunch. We know that the protein we have at that first meal really sets us up for the type of the day we're likely to have. And there's research showing that having protein and sufficient protein at breakfast can reduce hunger and cravings right through to the evening. And it's very often the evening that people will tell me when they really struggle with cravings for sweet foods, savory snacks as well. So have protein, set yourself up for success. Another top tip is to plan your meals and snacks. We want to give you your best chance of getting the nutrients that are going to really support your body, but also give you the best chance of feeling full and satisfied until your next meal. The idea is to have as much whole, real food as possible, because this is what's going to reduce insulin resistance, reduce inflammation, and help your body respond to the food. When we eat processed food, it overrides all our appetite signals and makes it much easier to overeat. So plan your meals and snacks. Make a time, every week or even twice a week to think about what you're going to be eating for the next few days. Plan that out and take food with you so that you can stay in control. Just wanted to touch on thinking about when you're eating as well as what you're eating. We know this makes a really big difference for insulin resistance, all the markers of metabolic health. So if you're thinking about wanting to bring blood pressure down, bring blood glucose levels down, bring body fat down for your surgery, then thinking about how long over the day you're eating can make a really big difference. So I mean by that, how many hours over the 24-hour period are you eating? And if you think about when you first start eating and when you stop eating at the end of the day, how many hours of that? And for vast majority of people, that's more than 12 hours. And actually, for nearly 50% of the population, it's 15 hours or more people are eating. So this is more time where our body is switched on. It's more time where our body is having to respond to food, to things like blood glucose levels rising, and it's having to produce insulin in order to bring blood glucose levels back to level. So if you can reduce the amount of time that you're eating over, even if it's by an hour to begin with, you're giving your body more of a chance to rest, more of a chance to bring blood glucose levels down, and it can help to reduce insulin sensitivity and reduce fasting insulin levels. So this is another powerful tool you can put in place. Okay, I just wanted to give you a bit of a insight really into what it might look like to eat for optimal balance, what might help you to get in the best place before your surgery. So this is our Coongrove balance plate model. And you can see I've talked about protein and its importance. That a quarter of that plate is protein foods. And that's a nice, simple way to think about it. Sometimes people want to think about numbers and how much protein, but thinking about 25% of your plate being protein is a really simple starting point. And then you can see that over half of the plate is non-starchy vegetables. So things like cabbage, green beans, courgettes, peppers, for example, generally things that are grown above ground. Now, the reason they are on there in such a big quantity is because they're going to give you colour, interest, diversity, texture, fibre, phytonutrients. But what they're doing by being non-starchy vegetables, they're not going to have a big impact on your blood glucose levels. That means you can really enjoy them on your plate. What we want is to minimize how often your blood glucose levels are rising to a big degree and how often your body is having to bring that balance back. And then you've got carbohydrate and fats on there as well. So we personalize each of those to each individual, depending on where their health is, what their goals are. But for carbohydrates, for people who want to work on their metabolic health, we say up to 15% of their plate being carbohydrates. And ideally going for those whole foods where possible. So things like squash, beans, pulses, things like that. And then natural fats. So that's any fat in its natural form that hasn't been added or processed. So it might be salmon, it might be fatty fish, it might be avocado, it might be coconut oil, it might be butter, it might be meat, it might be nuts. Any of those natural fats, using those as a condiment so your meals taste delicious, are satisfying, but also so you're getting those precious fats that are so important to our hormones, so important to our brain function. We all know the difference between having a food that just tastes wonderful and we're left feeling satisfied by, to something that leaves us sort of feeling like we're not done, we want something else, and fat can make that difference. So a bit of an idea of what that could look like. There's endless ways that this could look like, but just to give you some idea, I often talk to people about creating a deli plate or a deli box. So, if they're, for example, going out to work and they want something later, then filling it up with these foods that, that are like I've talked about this evening. So, hard-boiled eggs, or some smoked salmon, or some smoked mackerel, or some cold meat. Putting in avocado, some cucumber, some lettuce leaves, olives, nuts. It might be yogurt or berries, just making up whatever you happen to have. Keep it simple. These foods will give you a really good chance of having stable energy throughout the day and feeling full and satisfied. Lunch, again, simple thing is to have leftovers from your evening meal. Our evening meals tend to be more likely to be based on having, protein and fats and vegetables, or a salad. But I don't mean just salad of something, some leaves and not much else. Again, you need the protein and the fat in there. Maybe in the afternoon, a little top up, so nuts and seeds, giving you more protein and fats. And then the evening, well, on this day, I've done salmon with some vegetables, a tray bake. Some people might want to add more carbs to that. They might want to do some roasted potatoes, or sweet potatoes, or squash, rice or quinoa. Some people might not. It's all individual. And then perhaps some Greek yogurt and berries for pudding. So hopefully that gives you a bit of an idea of the foods that are going to help you be in the best place for surgery. Okay, so touching on our third route, which is sleep. Now, this for a lot of people is one of their biggest challenges. They struggle with sleep. They are waking up in the night or taking a long time to get to sleep. And we know that one night of poor sleep impacts our insulin sensitivity the next day. So it really can have a big impact. So if we can help you to improve your sleep before surgery, not only is that going to improve your health, but getting into these habits is also going to help you when you're, when you've got pain and when you've just had surgery. So a few simple things you could put in place now is to begin to think about your step down to sleep. Our body, our brain has got to be functioning different in order to get to sleep. We cannot go from doing something that's making us alert and concentrating, to having the lights on, to checking our emails or scrolling, to going to sleep. We need to have a transition, and we need to give ourselves time to do that. So can you think about what that is for you? And everyone is different, but it's just putting something in place and having the expectation that you need to have this window and this time to let yourself go to sleep. So one of the things that we find works brilliantly is journaling. So people being able to dump their thoughts, to get all of their what's happened for the day out of their head, so that they're not lying in bed thinking about that and dwelling on it. So could you earlier in the evening write down what's happened in the day? For some people, it's some sort of gentle movement in the evening. That's what helps them switch off. Some people, it's music. So it's very personalized, but thinking about what you need. And then the other really powerful thing that can help with sleep, and this on its own, for some people makes all the difference, is closing your eating window earlier. So stopping eating, giving yourself enough chance when you finish eating before you go to sleep. And this can really help you get to sleep faster, but also help the quality of your sleep. So if for the moment maybe the last thing you eat in the evening is 9 o'clock or 8:30, can you push this forward half an hour or an hour and bring it forward? It can make a really big difference. Okay, mindset. Another big topic, but a couple of things that I think would be particularly helpful, quick takeaways, are reframing. So if you're thinking about surgery coming up and you want to make some changes, how you think about those changes can make a really big difference. So instead of saying, oh, I should go out for a walk, say, I get to go out for a walk. Or instead of saying, oh, I shouldn't eat that, say, I get to eat foods that nourish me. So it's changing how we're thinking about it can make a massive difference. The thoughts we have are what our body's listening to. So thinking about what thoughts we're having, what language we're using. The other really important thing is, what is your why? Why are you here this evening? Why is it important to you that you have this surgery and it goes as well as possible? Because this why is what's going to make you make these choices every day, to do the things that Barry suggested, to do these strength training exercises every day. So getting as clear as possible on your why is really going to help you. So why do you want to have the best function possible? What difference is that going to make to your life? Okay, and finally, our fifth route is environment. So a lot of things about environment is about what we're surrounded by and where we are, but also the people that we're surrounded by and how we're responding to those things. So how we're responding to stress, for example. So for environment, I'd say make sure you are surrounded by people who prioritise their own health and who prioritise your health, because the people we're surrounded by, they really tend to reflect what we do ourselves. So, for example, if the people that you're surrounded by, aren't too focused on their health, then could you create that some way? Could you even online, could you follow people who are, so you're seeing that content and that's helping to inspire you? Okay, so here's a little summary of those tips. Nutrition, prioritize protein. Movement, practice the strength training exercises we've talked about. Think about when you're going to do them. Sleep, add in some sort of relaxation practice. Mindset, look for opportunities to nourish yourself. So really thinking about a positive way to frame things. And environment, surround yourself with people who want to improve their health and yours. So I hope that you feel like you've got something that you could take away and put into place. And these things can make a massive difference on how you feel that day, on your well-being, but then also build up to making health changes too. So I'd like you to think about, if you're here because you have surgery or are thinking about surgery, think about how you would like to feel going into that surgery, and think about how you'd like to feel in 3 months' time and what difference that could make to you. So I'd like to leave you with hope, because to me that is the most important thing, that you feel that there's something you can do, and there really is. So I'm going to play a video of somebody who used metabolic health to prepare themselves for surgery. So Claire, who came on one of our metabolic health programs, she had multiple abdominal surgeries, and she really felt like she was given back the control, and how effective this was for her. So I'm going to play that video for you.
So in January 4 years ago, I had an operation that ended in near disaster, and I had septic shock, and that ended in a long period of time in intensive care, and every part of me was affected by it, physically, mentally, emotionally, and I went from being a very strong, capable, outgoing, confident woman to somebody who was essentially, I had to just hand over everything to the people that were looking after me, and there were lots of different disciplines looking after me, and some had different approaches, and I felt really lost. I felt like my whole world had been turned upside down. Obviously felt very ill. It's just every part of my life had changed. And how I found you was I actually tried lots of different things to get myself feeling better.
I'm so sorry, you can't see that video.
I tried dieting, I tried anything I possibly could to get myself back just feeling better.
Okay, what I'm going to do, because I think it's nice to see the video as well as to hear. So what I'm going to do instead is just sort of summarize what Claire talks about in her story. Can you see the slides again? Okay, now. So you could hear it. Okay, you can hear it. It is a few minutes. So basically what Claire was saying, the impact of how she was feeling, and she wanted to do something to get herself in the best shape for her surgery. And when she was preparing for her surgery and went in to see her two surgeons, they said, right, we really need you to get yourself in the best place. You need to reduce the weight, and particularly abdominal weight, as much as possible, to give us the easy access and to reduce the pressure after the surgery was done. And so that's what she did. She worked on her metabolic health, and she reduced her weight, reduced all her health markers. And when she went back to the surgeons, they were blown away. What have you done? How have you done this? And this is going to make our lives so much easier. So it was a difference it made in terms of the surgery itself, but it was also the difference it made for Claire, both how she felt about the surgery, but also how she got her zest for life back and her energy back after a very difficult time of several surgeries. So that was Claire's story, and I wanted to share that with you to let you know that there's a lot that you can do if that's where you are and you have surgery coming up. It can make a massive difference. So I'm very briefly going to run through our metabolic health programs, and then we're going to answer questions. So if you've got any other questions, then please pop them in the chat box and we can talk them through. So our metabolic health program, basically people come and stay with us at Coombe Grove for 1 week, so that they can really embed themselves in an environment set up for success, set up to reset their metabolic health and make it and fast track them, basically. So everything here is designed to do that. So from the meals you eat, to be having access to all our movement facilities, having access to Barry, our strength and conditioning coaches, our personal trainers, trying all those different things and being able to put in place those exercises and make sure you feel confident with them. So that is our metabolic health program. So you have a 6-night stay here. As part of that, you'll have a personalized movement program designed to help you build strength and flexibility. You'll also have a one-to-one to discuss nutrition, sleep, mindset, environment. So really looking at all those different approaches. So you'll come and do that, then work on those markers with the plan you've got, and then you come back for 3 nights. So after your surgery, when you're ready, you can come back to continue your recovery, to work on new exercises, and continue your health improvement. So it's an opportunity to be surrounded by other people who are looking to improve their health and be surrounded by a team who are all here to support you. So our next metabolic health programs, our next one starts on the 31st of March. And the other alternative, we have a virtual program, Coombe Grove at Home, which supports people wherever you are over 12 weeks. And what we want that to be is a very personalised experience too. So you'll have your own dedicated metabolic health coach who will spend time with you one-to-one as well as a group. And you have 3 45-minute consultations. You have a box delivered to you with everything you need in for the program. So there's 2 ways to focus on your metabolic health. These are the costs of our metabolic health program. So that's everything I've talked about, all inclusive. So coming for that initial stay, returning for 3 nights, and obviously all those treatments, programs, access to everyone. We do offer a £250 discount to people who attend the webinar. So if you would be interested in booking one of these places, do let me know and we can utilise that for you. We are also developing a specialist prehab program at the moment, and would welcome the opportunity to hear your thoughts on that, and you just have a 10 or 15-minute conversation on what would be important to you, what are your concerns about surgery, asking you a few questions. So if anyone is interested in being involved in those conversations, please do let me know. Pop your email address into the chat box, or I'll put my email address in. Katie, if you could pop my email address into the chat box, please. Contact me and we can set up a time to have a quick chat. And as a thank you, we're then offering an additional £100 off our programmes for you. So our metabolic health programme, you can see here, starts at 2,950, or Coombe Grove at home is 1,200, but you have the webinar discount on those as well. So we hope that everyone this evening feels they've got something they could go away and put in place, so they could make a difference to their surgery. But we're now answer questions on anything we can do to help you. I'll have a look at what's in there. Thank you, Katie, for putting my email in there. So I've got a question: does the ICBs commission places for patients? That's something we will be working on. So that's something we're developing on, but not at this stage, no. The other thing we're also putting in place is a bursary programme, so making it possible for people to come and improving the access. So those are two things that we're looking at. Sarah said the food model looks delicious. It's a bit different from the Eat Well guide we're told to follow. Yes, it will look different to what you normally see. So our food model is based on the most up-to-date research on metabolic health. And so we're looking at what we can do to minimise your risk of those chronic conditions and also keep you well on a day-to-day basis. So that's why the model looks like that. And you know what people are really surprised at when they eat the food here and when they do it at home is actually, you know, it's keeping them full and satisfied for 4-5 hours or more. They're not feeling hungry all the time, and they're amazed at the difference that brings. Okay, Francesco, thank you very much for your comments. Absolutely agree. A multimodal programme is definitely what's needed, and that's what we do here. Need to consider all of those components together for people to get the best results. Thank you, and thank you for the example too. That's fantastic. Has anyone got any other questions for Barry or myself? Anyone got any concerns about surgery they've got planned, or any questions about anything they can do to prepare themselves? Okay. Well, hopefully you feel that you've got something to put in place. You know, maybe this evening, think about what it is that you're going to start with today, tomorrow. If you have got any questions and, you know, don't necessarily want to ask them in front of everyone, please do send me an email and we'll get back to you and help you as best we can. But thank you very much for joining us this evening. We hope you feel empowered about what you could do. And I wish you, if you have got surgery coming up, then I hope it goes very smoothly and you feel ready and confident with that. Thank you very much and good night.
Yeah, thank you.
Bye-bye.